The following individuals and families are examples of people who participate in a consumer-directed model called IHSS here in the state of Colorado. Please enjoy the following video series.
Mason, would you please introduce yourself and let us know what county you are living in?
My name is Mason Matthews. I live in Mesa County.
Okay. Can you tell us, give us a little history on what your diagnosis is and any secondary diagnosis that affect your condition?
My initial diagnosis was a spinal cord bleed. I think they called it a medulla infarct. Spinal cord bleed from C1 to C6,
Okay.
which left me paralyzed from the ears down.
How old were you when that
I was
happened?
37, 36.
Okay.
So I was just having a normal day. I felt really ill. I went to work and I went home for a while. Then I went to the student health center because I was working at the University of Florida doing a postdoc. And when I was waiting for the doctor, I had this tremendous pain. I was already in the exam room and tremendous pain in the back of my head and neck. And then I lost control of my right leg and started to lose my balance. So she called an ambulance. They sent me to the emergency room, and by that night I was on life support, on a ventilator, unable to breathe, and obviously no movement, hands, feet, anything else. And so since that time I've been, gradually trying to improve from there, and I have improved a lot.
How long were you in the hospital in Florida?
I was in the hospital for three weeks.
Okay.
A lot of that I don't remember.
Sure.
Obviously, I was totally sedated and in really bad condition. And then I went to Shepherd Center in Atlanta, which is a spinal cord and brain injury hospital. And I spent 2 months, 2 months there. They did some rehab, but I was in a condition where I wasn't able to do much, so most of it was training my mom how to take care of me, basically.
Okay.
And they did help me. I was able to get off the ventilator at that point when I was there, but I was still had the trach, couldn't swallow. And I started to regain some of the use of my left hand and my left foot, but I still was not able to do much at that point.
So when did you come to Colorado?
I was in October, end of October
Of last year,
of 2011.
2011.
So I was only at Shepherd Center for a little while, and there wasn't enough insurance or enough, funding to keep me there. So they discharged me, even though I probably should have still been in the hospital.
Okay.
So I required a lot of equipment, to suction the trach and do all these things, and but unfortunately I wasn't able to stay. So my mom had to take care of me and really do 100% of the nursing and all that.
And when you moved from Atlanta to Colorado, were you able to move home, or where did you go?
Home. Yeah,
Okay.
directly home.
All right, here in Mesa County.
Yeah, I was very
Okay.
fortunate.
Could you talk a little bit about how the IHSS program has impacted your progress and your recovery since you've been able to access those services and that support?
It's been huge. It's enabled me to be at home with my family instead of in a nursing home. I don't think I would have survived in a nursing home. Just emotionally, physically, I think the psychological aspects of recovery are just as important as the physical, and so that meant everything to be able to to be home.
Okay. Can you expound a little bit on just kind of the highlights of what your day entails in terms of what a caregiver provides for you in a routine day?
Well, but my mom is still one of my caregivers, so she helps me with preparing meals, with the things that I'm still unable to do, whether that's laundry, helping me with the bed. And there's a million things. I mean, I've progressed to the point where I can do a lot of my basic function stuff, but there's still a lot of things that I need assistance with. And she does stretching with me sometimes also when the other caregiver is unable to come. Obviously taking me to appointments,
With your particular situation, are you able to do the therapies independently?
No, not all of them. For example, if I have to do some transfers that are not completely safe, I'll need help, like getting onto a piece of workout equipment. And I have fallen in the past, so there's certain things where I still need help. Normal transfers, maybe getting to the bed, from the bed to the wheelchair, I can do all those things, but getting into the car, getting onto exercise equipment, and those things.
Okay, very good. As you know, we are looking at healthcare reform in Colorado, and if you could talk a little bit about what recommendations or suggestions you might have in regard to the future of like these kinds of programs, like an IHSS program, what it would mean for other potential clients that might need these services.
I think it's been huge for me, and one of the things that I find really helpful is the flexibility and the fact that we periodically update my program. That's been really important for me because I have changed so much. And the flexibility to say, well, I don't need help with this anymore, but I still need help with that. And I think it's been very adaptable to my changing conditions. So that's been a really, really helpful aspect of it. And like I said before, being able to be at home, I can't really describe what it would be like to be in a nursing home or something like that. I just don't think I would have survived that. I think that you get a much better result if you're, at home working with people. I mean, obviously there's cases where people aren't able to do that, but depending on their circumstances, health-wise. But for me, it's really been important.
This particular program is a consumer-driven program, so essentially you are the boss of you. Talk a little bit about how you feel that has met your needs, being able to be your own advocate.
I think that's really important to. Obviously, when you're dealing with physicians and doctors, they know things and they're able to tell you need to do this and you need to do that. But there's other aspects of your recovery where you need to be involved and say, this is working for me, this maybe not working for me, I need to do more of this, I think I need to do more of that. So to have that input, I think, is really important.
Are there any suggestions or any ideas that you might have for those that are at the state level or might be involved in healthcare reform regarding these kinds of programs or this particular program?
I would say definitely that they should, if you want to use the term due diligence, go out and talk to people and find out the stories. You can look at a page of statistics all you want, and I'm sure that's going to drive a lot of their decisions, but I think if they really had a chance to meet people and learn people's stories and not just look at statistics, I think they'll have a much better idea of the impacts of the decisions that they're making regarding healthcare.
One final question. Talk a little bit about the goals that you have for continued recovery.
I want to recover as much of my life as I possibly can. I'm still very active and engaged in research, and I'd like to recover as much of that as possible. Walking, you know, I'm getting close to that. I can walk with crutches, and I'd like to not have to use a wheelchair. So increased mobility, that's definitely one of my goals. I've been recovering the use of my right arm and hand, so I'm pushing for that all the time also. And